Hello, friends. Welcome to today's discussion on the topic handling prescriptions. Upon completion of this chapter, the students will know what is a prescription and different parts of a prescription, the essential steps during processing of a prescription, the common abbreviations used in a prescription. First of all, let us study what is a prescription. A prescription is a written communication from a registered medical practitioner or a doctor to a pharmacist, embodying salient instructions regarding the dispensing of prescribed medication. It designates a medication to be administered to a particular patient at a specified time. Every prescription have a superscription RX written on it. What does it mean? Abbreviation for recipe, the Latin for take thou or you take. Let us see what are the essential steps during processing of a prescription. First of all, a pharmacist should collect all information relating to a patient. All these informations have to be written in the prescription. For example, name of the patient, age of the patient, sex of the patient, the symptoms that the patient is suffering from. Not only that, all the details of the medications and the recipe of the medications. Apart from that, it should also contain the name and the seal of the registered medical practitioner. It should also contain a series of instructions to be given to the patient. These all information relating to the patient should be present in a prescription. A pharmacist should carefully scrutinize the prescription for quantity and dose, therapeutic use, and incompatibilities of ingredients. They are sole responsible person between a connect between the doctor and the patient. It is their duty to actually inform all the patients about the different dosage regimen. Not only that, different drugs that have been prescribed by a doctor, they have to explain the possible drug-drug incompatibilities, the possible drug-food incompatibilities, the time of the dose, and if there are different dosage that has been given, then equally spaced intervals or whichever interval that has been prescribed by the doctor, whether the dosage has to be taken before the food or with the food or after the food. All these instructions need to be provided to the patient. A pharmacist should check the label of a large quantity container. Now, this is specific when they have to dispense a smaller quantity from a large bottle. In that case, they have to doubly check the specific dosage and the drug substance, the drug product from the large label container that they are going to dispense. Thereafter, they have to properly affix labels on the smaller containers in which they are going to dispense. All the necessary information has to be written on the label on the smaller container. Informations like name, age, weight of the patient, type of the disease, any allergic reaction, identification of the agent, contact person on delivered prescriptions has to be there. Specific Drugs which belong to Schedule X category as per DNC Act, their special records have to be maintained by a retail pharmacist. Prescription records of Schedule X drugs and narcotic and psychotropic substances must be maintained and subsequently updated registered must be furnished to the drug regulatory authorities at regular intervals. Prescription contains some of the common terms that are used. These are all Latin terms along with their abbreviations. Some of the important ones have been covered here. BID is the abbreviation for bis and die. BID is the same as BD, which is also known as bis and die or bis die. This is but in English means twice a day. Tur and die or tur die, abbreviated as TID or TD, is 3 times a day. Quarter in die or quarter die, abbreviated as QID or QD, is the Latin term for 4 times a day. Quarter die, indice, quart, indice. These are the abbreviations for Latin term quarter die. This means in English daily. Post sebum. Abbreviation for this post sebum Latin name is P.C. It means in English after food. Antecebum, AC. In English, it means before food. Latin term C opus sit is the abbreviation is SOS, which means in English when required, take when necessary. For most of the analgesics and antipyretics, SOS is written in a prescription. Primulus is also written as primulus, which means early in the morning. Thank you for your time.